Hi, I'm Dr. Archie Johnson. In this video, I want to address some of the misconceptions that are taking place today in the field of treatment, clinical treatment, whether it's psychiatry, psychology, and even now in the exciting world of neuroscience, neurobiology. There's an old joke that goes something like this. There's an individual who's looking for something under a light in the dark in the evening, and as he's fumbling around looking for things, someone else, an individual, comes up to him and says, I see that you're looking for something. Are you looking for your keys? And the individual says, no, my keys I left over there in the dark, but the light's much better over here. And that's why I decided to come over here where the light is better. As goofy as the story sounds, it seems like in many ways it's very applicable to what's happening today in the world of neuroscience and neurobiology. As I mentioned in previous videos, there are two prevailing models today that I think are vying for the attention of people around the culture, around the world, especially in the United States. And these two competing theories are one I call the medical model and the other one I call the moral model. Now, both of these models have a place and they have some relevance in certain kind of situations, but when it comes to changing people, or what I would call a relational and neuroscientific look at what brings about real change in people's lives, something more is necessary. As I mentioned also before, we need to think in terms of sufficient and necessary conditions. And I want to describe that and unpack that a little bit more. So how do we get out of the dark and go where the light is much better? I think first we need to understand that the disease model, which is the prevailing model in the culture, has captivated the attention of so many folks today. In the 90s, I was trained in what's called the Diagnostic Statistics Manual of the American Psychiatric Association, and now in its version DSM-5. So through the years, the last 10 plus years, my initial training is I took a doctoral course in psychopathology at the University of South Carolina. I was very much taught that we need to think about the DSM, at that point was 3R, the model of what is a disease, what are addictions, and what are problems today. And so the folks who primarily follow a medical model are vying for the reality that people who have addictions and people who have disorders are caught up in some kind of a disease model. And as a result, this disease model then requires treatment, and requires maybe medication in most cases, and maybe it requires some kind of a 12-step approach to seeing people really change. Of course, from my point of view, the disease model does not have the same relevance as it would if we're talking about the liver or the kidneys. And many scientists, doctors who primarily would be physician or medically trained, would be folks who think that the brain is very much like the kidneys or the liver or heart transplant. I know two people recently who've had open heart surgeries, and their cardiologists, their surgeons are telling them, well, you have this disease, so it doesn't really matter what you eat or what you're doing, but that you just happen to be one caught up in disease. Now, when it comes to the brain, though, that model, I don't think it applies maybe even in the case of open heart surgery, but that's for another day, and we'll talk about what stress overload can do to individuals as well in an upcoming video. But for the moment, I want to stick with the disease and the moral model. So in terms of a neuroscientific perspective, then the disease model has captivated the attention of most people, maybe the majority of people in our culture today. So the question then is, why are people caught up in a disease model? Why are scientists and doctors doing that? And I believe that the disease model is primarily the prevailing model for issues like addiction, whether you have an eating disorder, whether you have a drug addiction or an alcohol addiction, that the disease model, the medical model, will say that these need treatment, and therefore we need to have some sort of a 12-step approach to deal with that. Now, as I've been working in the field for 10 plus years of seeing patients, I find that the disease model doesn't actually work, and that there's a high relapse rate for these individuals who were taught and trained under a disease model approach. And in particular, a side note, I had a call recently from one of the major medical model hospitals who asked me to refer some patients to them, and they said, we'll take your insurance and we'll even work out a payment plan. And I said to this case manager, by the way, what does it cost these days for a 3, 4 weeks, 5 weeks, 6 weeks inpatient hospitalization? She said it's somewhere in the $30,000 to $40,000 range for folks who are looking to get treatment. And unfortunately, with the high relapse rate, that it's very, very difficult. That people can spend up to $10,000 to even up to $100,000, according to recent studies, per month to deal with these particular problems that I call are disorders, but they do not fit very, very neatly into a disease model approach. A man recently told me that his wife and daughter have been in hospitals for the last 10 years, in and out of these addiction hospitals, and that he has spent clearly a fortune to try to get them treated and to get them stabilized. And when I asked him, well, how are they doing today? He said they've gotten no better. They're still in the same bad shape that they're into. Folks, I have a tremendous passion. I have a tremendous desire to see something more introduced to help people change. And I believe that the medical model in its best description, in its best classifications, fails to really describe what really is going on in the lives of people, which I will address more when I get into the very nuts and bolts of the neuroscientific approach. So the question is, why is it that 75%, at least according to recent studies, why is it that 75% of people who are caught in addictions, who are doing something that is controlling their lives, has totally ruined their lives, and the pain that they're going through is clearly disastrous? Why are these folks not addicted? Why do they not fit into an addiction model that requires treatment, they're into a disease, and then they need a 12-step approach? Why is it that 15% of these folks are the only ones that actually do have a disorder that becomes then the ruling force in their particular life? And I want to address that in these upcoming videos. It was recently I hospitalized somebody, I'll call her Millie. Millie, it was a Sunday morning, early Sunday morning. She'd been battling with major depression, and she had been treated by a lot of local doctors, and the medications weren't doing enough. And unfortunately, Millie became very suicidal. So through her permission, her family's support, I put her in the hospital. So as it turned out, that morning, as I'm heading for church, which is what I usually do on Sunday mornings, a lady approached me right before the service, and she said, Doc, can I speak to you for a minute? And I said, sure. What would you like to talk about? She said, I heard that you just hospitalized Millie. And I said, well, wow, the prayer chain really gets around very quickly, doesn't it? She said, yes. And I said, well, so what's your question? She said, I want to go talk to Millie in the hospital, and I want to tell her that she can make choices to not be depressed, that she can make these kinds of choices, that if she knew how to make these choices and knew how to do that, then she would not be battling with this depression. And I said to this lady, this very nice lady, I said, ma'am, I will not allow you to go. In fact, if you go and you're going to tell her that, I will ask security to stop you and prevent you from doing that. Well, you can imagine she was very, very distraught by me not allowing and supporting that particular way of thinking. You see, folks, I would call what this particular lady was telling me about Millie is that she has a choice. She can choose to be happy. She just needs to choose to make the right choices, as again, what I would call the moral model. And unfortunately, the moral model seems to be the other contending model in our culture today. So we have the medical model on one end, and we have the moral model that says make the choices, just do the right thing. It sounds like Nike just do it, and how most people have become so captivated in their way of thinking by this kind of approach. Now, I believe, again, there's so much good in the medical model. It applies in so many ways, or the moral model, but it does not, these two models do not sufficiently or comprehensively tell us what needs to be done in terms of helping people change and helping people live lives in new ways and in better ways. So what is the alternative model? The alternative model, I would suggest, is a relational and neuroscientific model. It's a model that says that when we know how to really connect with each other, then we can really begin to rewire and we can regulate each other on so many levels, especially on neuroscientific, neurobiological levels. The relational model that I'm calling the relational neuroscientific model began to become part of my way of thinking ever since the early 90s. I had just finished my PhD. I double majored in clinical psych and dynamic psychiatry. I was trained, fortunately, by experts on both sides in the professional psychological world and also the best in the psychiatric or neuropsychiatric world. And as I was being taught, medication was our primary driving force. The new SSRIs had developed, the Prozacs of the world, and we thought that there could be some tremendous benefits from this kind of medication implementation. I also decided, because I was very excited about this, I decided in the mid-90s to go to Harvard Medical School to train in psychopharmacology. There was an intensive course being offered for continuing education for doctors, and the course was in the modern advances in neuropsychopharmacology. And I wanted to be there. And so the leading experts in the world, the leading experts who wrote the prescriptions and who came up with the science and who did all those wonderful things were the folks I got to join in and train with in this intensive continuing education program. It was very, very moving and earth-shattering. On one slide, though, I remember, by one of the top leading neuropsychopharmacologists on the planet, during a break, I went up to him and said, "Dr. Ross, why is the brain moving when you give a 10 milligrams of an SSRI, or if you're given an antipsychotic? Why is the brain shifting and moving, and you could see it on neuroimaging?" And he said, look, Arch, I'm a biologist. I have no idea why that's happening. I'm only reporting what I'm seeing in the science and the neuroimaging. He said, your job is to present the dynamic reasons for that. And he said, that's not my turf, that would be your field. Well, as you can imagine, I was taken kind of back. Here was the leading psychopharmacologist, as far as I was concerned, on the planet, and yet he had no satisfactory answer as to why the brain is shifting and why the brain is moving in terms of medication. And now we know, 10 years later, we know the term for this now is neuroplasticity. Neuroplasticity, that the brain is going through all kinds of changes, and it changes all the way through life. Under the right conditions, in the right context, then the brain can change. And then that wonderful phrase that came out of the new epigenetic science, that when two brains learn to fire together, they can rewire together, and they can survive together. And this is the HEB rule, H-E-B-B-B, H-E-B-B, the rule that now I think has replaced the Mendel view of genetics that says that genetics are destiny. And I do not believe that that's the case. That now the brain does change itself, and it can change itself, but there has to be a regulated kind of context to make that happen. And that regulated context, I call it a bubble. I call it a relational bubble. The relational bubble by two or more people that requires skills. This model requires skills. It requires understanding about how to change the brain in a relational way and in a rewiring way. But it wasn't until the 90s that we discovered as doctors that the right hemisphere is the center of what real change is all about. The right hemisphere. And it wasn't until these studies were demonstrating on very complicated neuroimaging that we actually saw that we have two brains here. I teach that we have two brains. We've got a left hemisphere and a right hemisphere. And that for 50 plus years, that scientists have thought that the left hemisphere was in charge. We now know through a lot of wonderful studies, through UCLA, at Harvard, London, that the right hemisphere is really the center of the change process. The right hemisphere regulates us. The right hemisphere is what is required for us to deal with feelings, to deal with relationships. And if that right hemisphere is not operative and working like it should, as we see in all the psychiatric problems today, all the mental health problems at the center are showing right hemisphere dysregulation, malfunctioning. And so now we know clearly from the science, the brain scientific studies, that the right hemisphere is the center. It's the Jack Sparrow, if I can put it that way. It's the Jack Sparrow of the human nervous system. What do I mean by that? Again, I'll only be brief here, and we'll save more detail and more information for these upcoming videos. But in this video, I want to just say this about the right hemisphere, is that the right hemisphere is fully online in a child's life, an infant's life, by the time we're looking at 14, 16 months. So we now know that the subcortical areas like the amygdala, which is our fight, flight, freeze, faint response, and our subcortical parts of our brain, that this is, the amygdala does show up in the third trimester. On neuroimaging, we can actually see that the infants, the newborn infant or the preborn infant, that has an amygdala, and this is very responsible for our defense system. And then as a result, the other lower systems are starting to develop. So by the time the child is 4 months to even 8 months, we have a fairly developed nervous system intact. And then from about 8 months to about 14, 15 months, then the right hemisphere is fully online. Now this kind of information then puts a real question mark for parents who want to teach kids on how to read and how to become brilliant and become the next Einsteins of the world. This kind of science is challenging that. For example, the two centers that were discovered by Broca and Wernicke, the two doctors in the past that discovered the language centers of the brain, are not online until about 2.5 years old. And these would be left hemisphere issues. This would be a left hemisphere issue. And even according to a Harvard study, even the smartest kids on the planet, by the time they're 2, thereabouts, can only speak about 70 words, which again shows another reason why the left hemisphere is not online until about 3.5 years old. So what this has done, this kind of neuroscience, the neurobiology of nervous system development, is now showing that the right hemisphere is about attachment, it's about relationships, it's about regulating affect, what we feel, and it becomes the autonomic, it's the automatic system. It becomes the driving force of the ship in our lives. So when we think of in terms of the medical model or the moral model, that these two systems do not incorporate satisfactorily the neuroscientific findings that we have today. And therefore, we see that most of the people who are having some kind of medical problems, and especially mental health problems, are dealing with primarily attachment issues and neurobiological issues, because the right hemisphere has now been imprinted, and that this is what we now know in terms of how to change the brain, how to change the nervous system. Even though we're talking about neuroplasticity, under the right conditions, it's much easier to change the brain. As a patient said to me once, "Hey doc, you can't teach an old dog new tricks." And I said to him nicely and lovingly, I said, "You know, John, you're not an old dog though." And that we can change the brain, but we have to learn how to do it. And when you're 20 years old, for my viewing audience, when you're 20 years old, it's much harder to change the brain because we see the imprinting, we see the architecture, the apparatus of the nervous system as being pretty much intact. And that's then the hard job As a doctor like me, as a clinical doctor, a neuroscientist, and a psychoanalyst, then it's harder. My job is harder to begin to get in there and to do my heavy lifting to help the nervous system change. So rather than thinking of that people who have disorders or addictions, I should say, people who have addictions do have disorders, but it's not as clearly or cleanly as delineated as the medical model would like to present that to us. A number of friends have left the National Institute of Health because of the scientific reductionism, by making something way too complicated, or something that is too complicated, to make it something very simple. Simple as it's a chemical, it's some kind of chemical imbalance, or it's this part of the brain or that part of the brain. What's going on is much more complicated. And what happens is that people, I believe, who have disorders, who have things like depression, anxiety, and even addictions, whether it's eating too much, whether it's a sexual addiction or an alcohol addiction, are people who have been dysregulated through many significant stages in their lives, and are now suffering and are going through a lot of tough times because of this dysregulation that's intact. And by the way, too, once the brain is now moving in a dysregulated way, then we see more white matter in the brain and less gray matter. And what we need, and that shows that it's much easier now to stay with the addiction or the disorder and to reinforce it, much like a learning process or like a neurodevelopmental process. So I think if we're going to see real changes today, we need to know enough about the nervous system, just enough. We don't have to be neuroscientists and we don't have to go back to school, but we need to just know enough so that we can create a new kind of wiring in the brain and to stimulate that neuropathogenesis, a new way of creating something new, the emerging. And so we don't have to be in the dark or stuck in the dark. So if you think of someone like Snow White, Snow White ate the apple and she went into a coma, a sleep state for a long time. And this is very analogous to how the disease model is presented today. And that the only way to treat people in the disease model is through this kind of a 12-step approach or a behavioral approach, which often becomes rigid, and it doesn't produce the kind of lasting change in people's lives. As someone told me recently, most of the teenagers that come to her hospital come back many times over, and that's because the problem hasn't been changed. And the moral model, again, it's more than a choice, and it's more than maybe not having enough knowledge or not making the right decisions, but it's something more is involved. So don't tell your obese friend when you're sitting down with the table, your overweight friend, that when you put that plate of food in front of them, just push it back, As a friend of mine told one of his friends who was very much overweight, obese. And my friend felt shame, he felt very ridiculed, and he's struggling, he's battling with this disorder that I would readily call it a disorder. So folks, we need to have a better understanding of what is going on in the nervous system. What does it look like if it's a relational approach, and how can we change the brain in what I'm calling this relational model, and I've introduced it as SOAR, as seeing others through the art of regulating. And in the next video, I want to present more of the findings for you and also for me. So I'm excited about you joining me and joining us on this journey, and I'm going to produce more extensive videos as we develop further on. And it looks like it will be a total of 14 videos in what I'm calling track 2, and this neuroscientific way to understand relationships. I think it's very important for ADD, ADHD. I think it's very important for depression, for anxieties, for disorders of all kinds. There is a better way to do it that's even better than the medical model and the moral model. So I just thank you for watching, and in the next video, we'll then talk about my model in more detail. Thank you for watching. Bye-bye.